And thank you to all of you for taking time out of your evening to join us to talk about the federal bill that passed this summer and what it means for North Carolina and North Carolinians. This is our quarterly Making Connections webinar where we aim to connect the dots between people and policy across North Carolina. And we're so grateful to be with you in community tonight. For those of you who are new to the North Carolina Budget and Tax Center, we envision a state where every person can reach their full potential and achieve well-being. We believe this happens when we support trustworthy anti-racist institutions and systems that we can all participate in building. And part of our work tonight is to make clear how we can engage in the ongoing policy conversations happening at the federal and state level. We know that the decisions about where our dollars go and how our dollars get raised matter for everyday lives across our state. When our policymakers decide what they put in the budget, they're making decisions about our experiences in our communities and the quality of life we can hope to secure. And so these budget choices at the federal level and state level really matter for our goals to advance well-being for all people in our state. Unfortunately, the bill that passed this summer, referred to as H.R. 1, sometimes referred to as the One Big Beautiful Bill, is a harmful mega bill that takes away health insurance and food assistance to fund tax cuts for the very wealthy and a mass deportation infrastructure that will divide communities across the country. It places, in addition, the burden of unpopular tax cuts at the federal level onto state leaders who will have to fully implement the plan that has been passed by Congress and signed by President Trump by dealing with new costs at the state level. As I mentioned, this bill, in addition to advancing a tax cut agenda that benefits the very wealthy, also fuels anti-immigrant policy across our country. This is an important component of this bill that isn't talked about enough, in my opinion, and really is critical to understanding the underlying ideas that the federal government is advancing with this mega bill. H.R. 1 provides $170 billion in additional funding for immigration and border enforcement related activities. Among the changes in this bill are changes to the entire immigration system, converting it significantly towards a pay-to-play system that increases the fees for entry and securing of certain immigration status. It provides billions of dollars to build new immigrant detention centers, including family detention facilities. It includes billions for states to support border-related immigration enforcement and provides additional dollars to ICE for enforcement and deportation operations, significantly expanding this effort to increase anti-immigrant rhetoric. We'll talk more and we'll hear more about how it's also embedded in many of the decisions around healthcare and food assistance. But we know that it's critical for us to connect the dots between the ways in which healthcare for everyone and food assistance for everyone is put at risk by the anti-immigrant policies in this bill and by the tax breaks for ultra-wealthy individuals across the country. This graph shows just how significantly lopsided the tax plan that was extended under this bill and expanded on will be for the richest 1%. You can see here on the far right side the richest 1% of North Carolinians will receive an average tax cut of more than $61,000, while a North Carolinian living on poverty level income of less than $25,000 will see their taxes go up on average by $70. So this bill very much expands an agenda that tilts our tax code to the benefit of the wealthy and adds costs for everyday people across our state. And it's not just people that will be experiencing these increased costs. North Carolina, our entire state, everyone in our state will experience higher costs and new costs as a result of this bill. What Congress and the Trump administration has done with this legislation is push costs down to states by making very unpopular cuts to programs that states now will have to deal with. Among these changes that are now our state budget writers' decision to make in Medicaid, decisions around how to handle the fact that no new provider taxes can be used to fund the Medicaid program. The fact that the allocations to rural and safety net hospitals will need to be scaled back. These were providing $2.6 billion last year in funding to rural and safety net hospitals. And new administrative costs will be necessary to meet the work reporting requirements newly established in this bill. But the costs don't stop there. They also extend to food assistance, our state's SNAP or Food and Nutrition Services Program, or food stamps. This program now faces new administrative costs at the state level of more than $65 million a year. And for the first time in the program's history, states like North Carolina will have to cover the cost of food benefits, a share of it. In North Carolina, estimates are that would be $420 million per year. So they're very important decisions to be made as soon as possible by state budget writers to begin to plan for this cost shift, for the harmful cuts that North Carolinians will experience. And tonight we're here to talk about that, to hear from various perspectives about these issues, and to talk about what we can do and how we can engage right now to make clear that we want policymakers to choose people's well-being above all. I'm very excited to welcome our panelists to the floor now to share their perspective. I've asked them to each give an introduction, so I will just be brief in welcoming them and turning it over to them. I think we'll kick off, if I'm correct, Mel, with Jan Jones. And then we'll hear from Kate Woomer-Dieters, and then we'll hear from Hassani Mitchell. So Jan, I will put your slide up, and welcome. Thank you again so much for joining us.
Thank you, and I'm glad to be here tonight to talk about this a very important issue. And what I want to start out with is just kind of level setting of what we are experiencing right now. I am with Second Harvest Food Bank of Northwest North Carolina. We are in Winston-Salem, and we cover 18 counties across Northwest North Carolina, saying that we give our tagline of that we cover from Boone to Burlington. But I will tell you, there's a lot of land outside of that line that we have right there. So I have been, actually today is my work anniversary. I have been at Second Harvest Food Bank since 2008. So came in with the end of the, what was referred to, or the beginning rather, of the Great Recession. So I have had that experience of working there. So that is, as I say, with what we've just gone through with COVID, that really was very, very helpful to have that knowledge of that experience. So what we at Second Harvest Food Bank of Northwest, we do have a client information system where all of our 18 counties are connected to this one system. And we go in and we can see the numbers of individuals served each month. So, and again, this is across what you're looking at right now is the number of individuals served just through our food pantries. This doesn't include school pantries, backpack, our health and hospital pantries, mobile pantries, any of our nutrition services distributions, our summer feeding, our after school feeding, meals on wheels, or medically tailored meals. This is, I mean, as you can see, we have a lot of programs that we are feeding through, but this is just food pantries. And I tried to cover from January of 2022 on here, but it won't let, it would not fit on the page. So I've had to take a couple of months early on out. But as you can see, we start with January of 2022. The blue line is what we refer to as, this is our duplicated number. And this shows if someone, well, let me start with the bottom one. That is our unduplicated. That is counting each individual one time. So that, again, if they go to the food, only go to a food pantry one time during a month, they'll show up just one time in this line. The top line is showing if people have gone more than one time in a month. So that is what we refer to as our duplicated number. And as you can see that as we were coming out of COVID, emergency, all of the waivers during COVID were still in place at that time. So and what we're tracking now is basically what is happening when we are losing those waivers that were in place during COVID. As I say, I worked at the food bank during the Great Recession. We did not have the waivers in place, and we saw food insecurity spike during that time. We did not see it spike during when the COVID emergency waivers were in place, because those programs did exactly what they were supposed to do. Everyone had the necessary benefits to be able to take care of their family. They did not visit the food pantries as often. So, and then with the end, you see us start climbing up. And I have a couple of points on the timeline just to help out. The very first one you're going to see is in like March, April of 2023, when the FNS emergency allotments ended in February. You can see it really starts going up during that time. Then the next there is in the summer of 2023, we did have pandemic EBT benefits issued for that month for the kids that were in school. We really have a sharp climb right after that. Again, as you can see on the chart. And it's kind of, it levels off a little bit. We see sunbucks. One thing I also want to mention out is that historically, as long as I've been at the food bank, one of the things you'll see that kind of like November, December, we'll have a little bit of a dip. That is because so many other programs that aren't open year round will offer food and the households will have access to different resources just than the food pantries that are open year round. So I just kind of wanted to point that out. Then as you can see, when I did this, the very first time I did this chart, I went and talked to my VP and said, what happened in September, October of 2024? And as soon as the words rolled out of my mouth, I went Hurricane Helene. And you see a big spike there at that time, but then you also see it's just drop down. Again, there were a lot of resources put in place across the area impacted by Hurricane Helene that dropped as the food pantries. Well, some of them weren't even able to be open, but there were a lot of resources added into the counties at that time. And so a decrease, but again, as you see, it has started back up. back up again and is continuing to trend up. So I just wanted to point, just show you that kind of as a level setting. And what we know, what we're seeing during this time is that with these increases, this is going to be the inflation and the rising cost of food that our households are experiencing. That, they are still on a fixed income, most of, even if you're working, your income is pretty much set. And then with the rising cost, this has had made households come to our food pantries for the first time and they've never been before. They're new to our system. We also, as I pointed out across here, we saw the ending of the supports that were in place, even the expanded child tax credit that was available during that time. We've lost that. SNAP emergency allotments where everyone was receiving the full benefit amount. And then we've also experienced cuts in the federal nutrition assistance programs. Free school meals during COVID, everyone received the free school meals. We've gone back now that people, you have to, qualify through either receiving SNAP or Medicaid, or households have to apply. And again, it's not free school meals for all. Some counties, yes, but not all. We've also experienced cuts to, there's a federal nutrition program called the Emergency Food Assistance Program, or TFAP. And that is a program that food comes to the food banks for us to distribute out to our partners. And this year we experienced a cut in that of 940,000 pounds of food just through the cuts in that program. We also lost the local food purchase assistance or agreement funds that were coming in. That was $2 million. That would have come in just to our food bank. Again, all the food banks in North Carolina lost this funding when that program went away. We also, as I say, I want to point out Hurricane Helene has been a big effect across our service area, much more with our sister food bank, Manna, that their entire service area was covered by that. And the Manna Food Bank also has the distinction of being the only Feeding America food bank that has been totally destroyed during a disaster. So they got back online very quickly, which was, very amazing for them. But again, they are still continuing to recover from that, just the food bank itself, but also the area. Another thing that contributes to this that we know are long-standing structural inequities in our system. When we look at how food insecurity is disproportionately high among households of colors, those who live in the South, and families with children. And I also want to point out, I've probably gone over my 5 minutes, Alexandra, and I apologize. I just want to point out, for every meal that a food bank provides, SNAP provides 9. When as Alexandra's already mentioned, the cuts that are coming up, this is where we are right now. When those SNAP cuts go into place, I am just, again, for every meal we provide, SNAP provides 9. I don't know how we can prepare for that. So, Alexandra, I'll turn it back over to you.
Thank you so much, Jan. That was a sobering picture of where we are right now, ahead of the impacts of the harmful mega bill. But also, I think you told some very positive stories about the way public policy has been able to support people and make sure they have what they need to put food on the table. Thank you so much for all that you're doing and for being here with us tonight. We're very grateful. I want to turn it now to Dr. Garrity, if that's okay, to share more about the impacts of Medicaid cuts as you see it in your work. And thank you so much for joining us. And then we'll go to Kate and then Hassani.
All right. Hi, everyone. I'm Raymond Garrity. I'm a nephrologist, a doctor specializing in kidney disease. And I'm here to speak a little bit about how the budget bill will affect Medicaid, specifically for patients in North Carolina, but this, generalizes to everybody across the country. Um, I practice primarily in Wake County, but also in Johnston and Harnett County, and I see firsthand how access to Medicaid expands access to health for hundreds of thousands of people in North Carolina. And every day I care for patients who rely on Medicaid for their health care. I've served this community for many years, and I know that Medicaid is a lifeline for many North Carolinians. Single parents raising kids, seniors, people with disabilities, ordinary hardworking Americans who hold two jobs and still can't afford insurance from the marketplace. And these people really depend on the access that they get from Medicaid to stay healthy. There are neighbors, our loved ones, people who do jobs that we count on, servers at restaurants, bus drivers, our children's daycare teachers, the aides who provide home care for our parents and grandparents, and President Trump and the Republicans in Congress who voted for this budget are taking away this lifeline for 650,000 people in North Carolina, so they can give handouts to billionaires who already have enough. Taking away their health care will make these people sicker, less able to work, more likely to miss a paycheck, lose their jobs, and be unable to support themselves and their family. When people have access to affordable health care, they're more likely to see a doctor when they need to, get regular checkups and screenings, fill their prescriptions and take their medications as prescribed, manage their chronic conditions, and manage the chronic conditions that disproportionately affect low-income, underserved populations. And a lot of these things have already taken effect by the time they see me as a kidney specialist. A lot of these patients, these people, could potentially avoid seeing me altogether if they have access to reliable, adequate health care. Um, in addition to that, people who are already on dialysis, as a kidney specialist, I see people in the outpatient clinic and also in the dialysis unit. When somebody's kidneys no longer work at all, they need dialysis 2, 3 times a week just to stay alive. And this Whenever I talk about Medicaid, I think about one of my patients from the dialysis unit. He was a young man. He had kidney failure. He needed dialysis 3 days a week. He's an immigrant who came here with his family for a better life. He was a hard worker, but eventually he had to stop working because the demands on his body of doing dialysis and the demands on his time of doing dialysis for 4 hours, 3 days a week, just made it untenable to keep a job. Um, but he was able to get emergency Medicaid and he got a kidney transplant and he was able to get off of dialysis and go back to living a normal life. This is going to be impossible soon. This is not going to be an option for people who don't have access to emergency Medicaid. Um, Taking away Medicaid will delay preventive care and make it impossible to get necessary care that can treat or detect illnesses before they need treatment. We're putting North Carolinians' well-being at risk by backing them into a corner and making them feel like they need to wait until their medical condition becomes an emergency to see a doctor. And that can be the difference between needing a pill for your diabetes or needing insulin, needing a statin and some exercise to open heart surgery, needing blood pressure medications, or needing dialysis. Take away Medicaid, and low-income women will lose access to breast and cervical cancer screening services, mammograms and pap tests, things that are easy and simple, and they can detect cancer and save lives. Health screenings that detect risk factors for heart attacks and strokes will no longer be available to many, which means that they will be devastated by these illnesses and, their lives will never be the same. We've all heard time and time again that emergency departments are overcrowded. Uh, I've seen it firsthand. I'm sure many of you have seen it firsthand as well. If over 600,000 North Carolinians lose access to their health insurance, the insurance that enables them to see their primary care doctors when they're sick or just for routine screening, then we're going to see more people showing up at the emergency departments and things are going to get more crowded and waits are going to be longer. Everything is going to be more difficult. By the time they get to the emergency department, they'll be sicker. Their medical conditions will have worsened. Treatment will be more difficult, more complex, and more expensive. These people won't have a way to pay for their complex and costly care in the ER and in the hospital, and this means that the hospitals will get stuck with unpaid bills, losing billions of dollars themselves. These Medicaid cuts threaten to close 5 hospitals in North Carolina, meaning that entire communities will have less access to primary care, doctors, specialists, vital units like labor and delivery. These costs will get passed on to everybody else, including people who do have health care in the form of greater insurance premium, higher insurance premiums, and greater out-of-pocket costs. Businesses that provide health coverage for their employees, they'll be forced to cut costs elsewhere. They may stop hiring. They may cover, they may opt for a cheaper, less comprehensive insurance coverage, reduce wages, require employees to pay higher deductibles. By taking healthcare away from so many people, the Republicans are setting in motion a domino effect of harmful consequences that will leave North Carolinians and all Americans sicker and poorer. Thank you.
Thank you so much for sharing your perspective. You really painted a clear picture of how the policy choices in this bill will play out across our state, impacting not only those right now receiving health care through Medicaid and the providers, but all of us as the hospitals and other aspects of our healthcare system are impacted. Thank you so much for taking time to be with us, and appreciate your perspective. I'm going to turn it to Kate and share my screen again with some slides for Kate to share a little bit more of your perspective.
Thank you. Can you hear me? Okay. Thanks for having me. My name is Kate Wimmer-Dieters. I'm an attorney at the North Carolina Justice Center in Raleigh. And I am here today to talk a little bit about how the congressional budget bill from this past summer will impact immigrants, and particularly how they will or won't be able to access benefits once the full impact of this bill comes into effect. It's really important for me to start off by saying that benefit programs for immigrants, and when I talk about benefit programs, I'm talking about Medicaid, I'm talking about SNAP, I'm talking about SSI and Work First, have always been restricted. They've been restricted for decades. And one of the pieces of this bill that is frustrating me the most is that there's a talking point that's been clearly handed out to all of the Congress people, saying that what this one big beautiful bill did is that it restricted undocumented people from using benefit programs. I have heard Congress people say that on the TV news. I've heard Congress people say that on NPR. They've clearly all agreed that that's the message. And it is false. It's not misleading. It's not a half-truth. It's just false. Undocumented immigrants have been excluded from the vast majority of benefit programs, with exceptions for things like emergency Medicaid, for decades. They are not eligible for Medicaid currently, or earlier this year. They're not eligible for the ACA. They're not eligible for SNAP. And so when Congress wanted to cut people from the program this summer, they had to turn to documented immigrants. In the mid-1990s, Congress already cut benefit programs from undocumented immigrants drastically, right? So we had a huge push for this back in 1996. At that time, Medicaid, SNAP, TANF, and SSI were severely limited to very narrow categories of lawfully present immigrants. When the ACA came around in 2010, that was the first program we had that was broadly available to lawfully present immigrants, right? The ACA has never been available for undocumented folks, but it was much more broadly available for documented immigrants. And so it was kind of a lifeline to healthcare for a lot of immigrant residents of our state. Mixed status immigrant families where the parents may have lacked a social security number, but the children did have one, have also been eligible for child tax credits in recent years. So that's kind of the landscape before this bill passed this summer. And then moving forward to the next slide, the budget bill absolutely gutted that eligibility for, again, lawfully present immigrant families in North Carolina, not for undocumented people. They're already not accessing these programs, right? So SNAP has been restricted down to 3 categories. LPRs, also called green card holders, Cuban Haitian entrants, which is not all Cubans and not all Haitian people. It's a limited category of Cubans and Haitians, and COFA migrants, who are extremely limited, especially in this state. COFA migrants are people from the Micronesia, Palau, and the Marshall Islands, right? So you can imagine that's not very many people. There are a handful of states, namely Arkansas, where there's a lot of COFA migrants, but not here in North Carolina. So that's it. Who are 2 big categories that you see who've been excluded from SNAP assistance? Asylees. I'm not talking about people applying for asylum. I'm talking about people who have been granted asylum, who have proved their case in front of a judge, and refugees, right? These are people who've spent years abroad being vetted by refugee agencies, having their backgrounds checked, proving that they've been persecuted on the basis of their race or their national origin or their religion, coming here to the United States, lawfully setting foot for the very first time lawfully in the United States. These folks have been excluded from SNAP assistance. That provision went into effect, as far as we know, immediately already as of this summer. The child tax credit is now going to require one of the parents in the household to have a Social Security number. It used to not require either parent to have a Social Security number. So this will exclude a potentially around 2 million US citizen children from the child tax credit, or from their families from receiving the tax credit. The ACA has been absolutely gutted for lawfully present immigrants. The eligible categories have gone from nearly every lawfully present immigrant in the United States down to the same 3 tiny categories. I shouldn't say tiny. Green card is a large category. The other 2 categories, Cuban Haitian entrants and COFA migrants, are tiny, right? So 3 categories of immigrants. Everyone else who's lawfully present has been cut from the Affordable Care Act under this law. That includes refugees, it includes asylees, it includes people with TPS, it includes people with DACA who just became eligible for the ACA last year. It includes people with lawful visas, right? Lawful work visas or lawful student visas in the United States. These are people lawfully present, right? And they've been cut. The tiny saving grace I can say about the ACA is that it's not going into effect until January 1st, 2027. So we have a little bit of lead time. Maybe there's time to change this provision. It's not in effect this year. I'm sorry, I misspoke. ACA premium tax credits. I'm sorry, I misspoke. Yeah, the premium tax credits, yes, that's in effect January 2027. There's a different provision going into effect that I don't have time to explain in this 5-minute window that's going into effect in 2026. Medicaid also being cut drastically, refugees and asylees being cut out of Medicaid, going into effect next year in 2026. So if we can move to the next slide. There's one really important thing I want to say, which is that none of these provisions affect pregnant women and children who are lawfully present. North Carolina has adopted what's called CHIPRA expansion, which provides Medicaid to all lawfully present pregnant women and children, and that has not changed, will not change under this bill. Now, a concern that I have is that if North Carolina needs to simply save money on Medicaid because of the cuts that Alexandra was talking about earlier, they will eliminate this provision. But that has not yet happened. As of now, pregnant women, children in all lawful statuses in North Carolina can continue to be eligible for Medicaid. And then I just have one last slide here about the impact. We don't have exact numbers here on the impact. We know some things. So we know that in 2023, 8,000 refugees were enrolled in SNAP in North Carolina. All 100% of those folks have now lost eligibility as of this summer. And going back to Jan's presentation, right? They are probably now walking into food banks and places that Jan and her colleagues are going to be trying to serve, right? There are other 9,000 citizens who were enrolled in SNAP, non-citizens enrolled in SNAP in 2023. Some of those will likely lose eligibility. There were 75,000 non-citizens this year enrolled in Medicaid. We don't know what percentage of them are the types that have been cut out of eligibility and what percentages are not, but some percentage of those will lose. And then the one that I think is going to impact the largest number of people are the Affordable Care Act cuts. We believe that somewhere around 150,000 immigrants are likely enrolled in ACA now in North Carolina. That's an estimate based on some studies. That's not a precise number. I think a very large percentage of those will lose coverage. I don't know how many, I don't have a number, but I think it's likely to be in the tens of thousands. So you can imagine the impact that these cuts are going to have on food banks like Jan and her colleagues are running, on rural hospitals like Dr. Garrity was talking about, right, and emergency rooms. These are people who were previously covered, who were previously eligible, who are here lawfully, who are no longer going to be covered when the full provisions of this bill come into effect. And so it's really going to have a devastating impact on individual families, but also on our healthcare system and our food banks and our emergency and crisis service providers.
Thank you so much, Kate. I know I put a lot of pressure on you to condense to 5 minutes, so please add questions in the chat and in the Q&A. If we can't get to everything tonight, we will follow up with answers. But I think, Kate, you did a great job of providing some really important context around how this all started and the misinformation that's being driven by an agenda to really hurt people and families across the state. And I think you've highlighted a way in which state policymakers now have to protect those who can still access Medicaid, pregnant women and children. So appreciate all of the content you shared with us. I'm going to turn it now to Hassani to share perspective on the bill, and so grateful to have you here with us. Thank you for taking the time.
Yeah, absolutely. Thank you, Alexandria. I'm Hassani Mitchell, and I serve as the Democracy and Economy Coordinator with the North Carolina Black Alliance. The North Carolina Black Alliance, we are a nonpartisan 501c3 located in Raleigh, and we're really a statewide organization, and we work to enhance the well-being and advancement of Black communities through systematic policy change. We really serve as an intergovernmental organization that unites legislators, municipal officials, county commissioners, community activists, really to amplify the collective impact and foster intentional engagement with Black constituencies across North Carolina. And so tonight, I really want to just speak briefly about the negative economic impacts that this bill will have towards Black and Brown communities in our state and low wealth communities in North Carolina. I think specifically, this bill will have a wide range of impacts for low and moderate income communities. It's important to note that the tax cuts that we speak about, they're really based upon household income. And so really wealthy Americans are going to benefit far more from the tax package than those lower individuals who make lower incomes. And so while everybody is going to see their taxes reduced, really 60% of the benefits are going to go to individuals making well over $200,000 a year. And so that's really the top 20%. And so if you are someone in that lower income bracket, if you earn $35,000 or less, you're only really going to see a cut of about $150. And so we're talking food service workers, retail workers, childcare workers, blue collar workers, really the backbone of our labor force, individuals making $35,000 or less. You're really not going to see a benefit from this tax package. Also, I know someone talked about itemizing your taxes. If you're someone who itemizes your taxes, you'll see a benefit. However, most low income earners don't itemize. And so the state and local tax deduction, known as the SALT deduction, it will be raised from $10,000 to $40,000. And so this provision is going to primarily benefit upper middle class earners, since lower earners typically don't itemize their deductions. I guess even to take it a step further, this bill is actually going to cause us to have lower tax revenues. So it's going to have an inverse impact on low income earners. And so lowering the amount of tax revenue that the country collects, that the state collects, while increasing, inside of this bill, there's increases in spending on defense. There's increases, as we've talked about tonight, on immigration enforcement. This is going to contribute to an increased debt limit. And so the Congressional Budget Office, they estimate that this bill is going to add over $3 trillion to the federal deficit over the next 10 years. And so what we believe is that, Black North Carolinians, low-income North Carolinians, people of color, low-income earners, you're going to feel the consequences of this ever-growing debt in your wallet. And the Congressional Budget Office estimates that this bill will potentially increase interest rates. So that inverse impact on, low income earners, that could increase interest rates. So that could make mortgages increase. That could make your car loans increase. That can make your credit card payments more expensive. And so I think the last thing that I want to add, this bill, it makes an enormous cut to the Consumer Finance Protection Bureau, and really almost 50% of the operating budget for the Consumer Finance Protection Bureau. And if you're not familiar with the Consumer Finance Protection Bureau, this is the agency that really serves as the financial watchdog to keep hardworking individuals from being, scammed and being cheated, like credit card scams, payday loans, mortgage scams. And as we know, these transactions are typically targeted towards, Black and brown consumers, low income earners. And so there's going to be a huge gut to the Consumer Finance Protection Bureau. And so you may see just your low income earners really getting caught up in a lot of financial schemes that really aren't going to build wealth in the long term. And then finally, when we talk about the economic impacts to Black and brown communities, we've got to mention there will be changes to student loan repayments. Most folks, we have a lot of individuals, first-time college students. This bill changes the taxation policy on certain kinds of student loan forgiveness. And so if you can recall, since 2021, student loan forgiveness has been tax-free at the federal level through the end of 2025. But under this bill, while making other specific kinds of student loan tax relief, it really did not extend or make permanent that broader provision. And so I really wanted just to lift those negative economic impacts that this bill is going to have to low income earners, to your taxes, to really watchdog agencies that are really housed at protecting you from being scammed, so you can actually build wealth. And so yeah, it's very problematic.
Thank you so much, Hassani. You shared so many concrete examples of how the cost for everyday people across our state will go up as a result of this bill, and how it will have a disproportionate harmful impact on communities of color across our state as striving to make ends meet and to get ahead in work through job training and education opportunities. There's so many barriers built up in this bill rather than taken down, and we see how the wealth and well-being of the very wealthy has been prioritized. Thank you so much for your remarks, and thank you everyone on the panel for sharing your perspective. So I'll turn it back to you, Mariah, but I just wanted to emphasize that, and maybe we can talk about ways to engage right now in this moment, and I'll pull up the slides for that.
Thanks, Alexandra. So as Alexandra mentioned, right now, our state leaders have yet to finalize a budget for this fiscal year in this biennium. The result is that there are, as our panelists have talked about, there are massive funding gaps for programs that people rely on, such as healthcare and food assistance, that will only continue to get worse as these changes are put into place. And we also have the income tax cuts for the wealthy and corporations that will move forward as of January 1st, 2026. And these will move forward without any debate or without any consideration for what our panelists just talked about the impacts that we will see from the mega bill that Congress just passed. So right now we have an opportunity to really, as Jan mentioned, connect and communicate with our state lawmakers to demand that they pass a budget that pauses these income tax so that we have enough state revenue to, fund these programs and really minimize the harm that HR 1 will have on our communities. You can also engage with us by joining our street teams where you can volunteer to share flyers and yard signs with this information to spread the word about the impacts that HR 1 will have in our communities and on the people that we care about. You can also stay connected with us and join us at our December Making Connections. And you can visit our website and follow us on social media and as well as through emails in order to stay up to date or on when that is. We'd love to stay connected with y'all, and we hope that this was very informative. I believe we have an evaluation, so if you would please scan the QR code, help us to make these conversations better to as we continue to have these conversations and really push this out there. If you want to join the street teams, you can email us at info@ncbudget.org and we can get you connected to our teams. And we'll be able to send you out those materials as well.